Welcome to the 69th Annual Utah State Historical Society's annual meeting, our 69th annual meeting. I am Holly George at Utah Historical Quarterly. This year, our theme is Public Health and the Common Good, very timely. And before we get started, I want to take a minute to thank our sponsors. The Utah Division of Arts and Museums, our sister agency, the Utah Department of Cultural and Community Engagement, our parent organization, our parent department, and then some of our friends and partners in the community, Utah Humanities and Utah Westerners. We are very grateful for their support. We are streaming live on Facebook, and also a reminder that this session is being recorded so that we can afterwards put it on YouTube on our channel. So if you go to YouTube, look for Utah State History. And another piece of housekeeping, another bit. This is our last session for today. It's been a very full day, but tomorrow we are wrapping up with our keynote address. Very thrilled to have this as Dr. Deidre Cooper Owens talking about why history matters in medical education. And today we are talking, today's session, about those things, about epidemics, public health, disease. And we have some wonderful speakers today. We have via video, Michelle Tucker, who is a research specialist at the American Research Bureau, Cherie Nash Willis, who is a librarian at the beautiful Salt Lake City Public Library, and then Ronald G. Watt, for many years who was for many years an archivist at the Church History Library, the LDS Church History Library, and also for many years has been associated with the State Historical Society and Utah Historical Quarterly. And I learned that Cherie worked for State Archives for years, our good friends at State Archives. Okay, so I will be introducing and moderating this panel, and we also have help from our editorial intern at Utah Historical Quarterly, Sadie Nellis. So we're very happy to have Sadie. I will start out by showing Michelle's video, and that will be about 15 minutes, and then we will move into Cherie's presentation. All right, so I am going to share my screen and move to Michelle's video right now.
Hello, I'm Michelle Tucker, and I'm presenting my portion of the panel entitled Public Health Nurse Mabel Jones and Lehi Doctors Immunizing Lehi and the Poor During the Epidemics of the Mid-20th Century. Like the rest of Utah, people in Utah County were ravaged by epidemics. Nothing frightened parents more than the poliomyelitis or polio virus. Utah County had a unique role in fighting this virus. Public health nurse Mabel Jones had cared for hundreds of polio victims. So I maintain that the disease prevention immunization efforts of these healthcare professionals from 1954 until 1962 in disease prevention best served everyone, including the poor, through organized community efforts. This group of healthcare professionals, I focus on Northern Utah County public health professionals, were pioneers in their field. One such overlooked trailblazer in the public health field is public health nurse Mabel Rockwell Jones. She had earned her credentials to get paid for nursing. Women often did pro bono nursing. During the Great War, that was changing though. In 1918, Mabel Rockwell, she earned her nursing degree from LDS Hospital Nursing School. Born Mabel Rockwell into the Rockwell family. She was a great-granddaughter of Porter Rockwell. When her mother became crippled, she, her younger sister, and her mother moved to the Rockwell Ranch. Now, her mother had become crippled for the rest of her life. Mabel took care of her crippled mother since the age of 4 years old, until she went to Lehi. She joined the battle against the influenza epidemic in northern Utah County. She came back to Lehi when she was hired by Dr. Fred Worlton. He opened the first Lehi hospital. So she was working at the Lehi hospital, but she writes in her journals, people were poor and they couldn't afford nurses. That meant that she didn't have a job there at a cafe and had to work as a cook. Next, the New Deal got nurses back to paid employment. The Emergency Relief Association hired Nurse Mabel, now Mabel Jones. She worked in this role as a nurse for the Emergency Relief Association from 1933 to 1934. In 1939, Utah County hired Nurse Mabel Jones as their first public health nurse, and she got her credential in public health nursing. Nurse Mabel returned to Utah County to find it embroiled in an epidemic of polio cases. And the city doctor was now Dr. Elmo Eddington. So Dr. Eddington worked closely with Mabel Jones. They gave immunizations to people. Here with the arrow, you can see Dr. Eddington. Now there were efforts to help with this polio epidemic. They worked as a team because it was a crippling disease if they didn't die. Very young children, this is a 2-year-old who has braces on, and also this metal pipe parallel bars was used by those who could afford to buy them to have the children practice on. Giving immunizations, and it's applicable to today when certain populations of children in certain areas cannot afford treatments or medical equipment, as it was in the mid-1950s into the 60s. But on the other hand, vaccinations are covered by the federal program Vaccines for Children for all children under 19 years of age. So the results of my research are that public health nurse Mabel Jones's efforts, in addition to the doctors who worked with her, helping post-polio cases, children who already had polio, often failed to save poor children from being crippled for life, whereas the new vaccine, and the one that Mabel Jones gave and the others, was a pink-coated sugar cube of the Sabin vaccine for polio virus. That vaccine leveled the socioeconomic barriers because school children had equal access to this because they were given it in school. To help children, they needed braces, they needed a warm place, they needed therapy, they needed to practice walking, and back then they didn't have health care insurance. It was very rare, and the families who were middle class and higher could afford to buy all these things, and they also already had warm rooms and beds for the children to sleep on, and she noticed that they didn't need much therapy and they were recovering and walking. And she had several patients there, but she tells of one young boy, and his family lived in a sheep herder's wagon, and they had a tent outside. So year round, the boy was sleeping outside. He got polio. So what Mabel Jones did was she went around and got Army surplus blankets, and she also got siding, metal siding. And so like this boy, she took the blankets and she put them in the corner of the kitchen in the shepherd's wagon. And she had the boy lay there 24/7. And so he was by the warm kitchen oven that they had, or stove. And so now he was warm. And then she took the sidings and she wrapped them around each leg and tried to keep them as straight as possible. Unfortunately for that very poor family and that boy, he did never walk again. So it is a tragedy. And she kept serving, and hundreds of children she worked with who had polio. And then the Salk trials came in 1954, and these were supposedly killed virus immunizations. Because Utah was a spot, especially Utah County, where the vaccine trials through shot were being performed here. And we had a successful trial with the vaccine. It started in Provo and then American Fork and Lehi. And these children told stories of how when they were little at Lehi Elementary School, they lined up in front of the coat racks, and it would be Nurse Jones and then one of the doctors. And they would alternate putting the shot in the arm for the child. And they had, these children, remember, there were only 6 needles. And so those were going to go into hundreds of children in the elementary school. And they had what was called a sanitizer sterilizer. And the adults who gave me their oral history renditions said how they would put the needles back into the sterilizer, and then they would take out the one that was ready and give it to the next child and put it back in, and then take the next one in line. And unfortunately, in other places, like the Berkeley lab, didn't have quite killed virus of the polio virus. And when they gave the shot to children, it resulted in many deaths. So the public got the idea that the Salk virus given through a needle was not popular. And in response, the public wanted a cure. And you had Sabin, who was working on he called his live virus. And it even resulted in some deaths. So what the public would accept was not the shot from Salk, but they used sugar cubes. It was a pink liquid that was the vaccine, and they poured it on the sugar cubes, and then each child got one to chew and swallow. And same thing, the Lehi elementary school children lined up again. They each were giving the pink coated sugar cube, and they remember chewing it and swallowing it. There was Dr. Eddington, and then later also Dr. Larson and Mabel Jones. They also gave immunizations in the clinics for the general public. So they advertised in the newspaper that they would be having the clinics at these times. And it seemed like each doctor, Eddington and Larson, took a shift, but Mabel was always working. So you would see her name. Her clinics were happening where she was working all the time. How they reported in the Lehi Free Press, April 15th, 1954, it said some 393 children in American Fork and Lehi are eligible to receive the vaccine. They were doing this with the trials in 1954, which will be administered by local doctors. And actually it was always Mabel Jones and a doctor. So they failed to mention and give her credit in that article. So another article mentions that the trials were actually given to first through third grade students at the Lehi Elementary School. The students were giving a shot in the polio trials. So at first it was the shot, and what they did was for the Salk polio trials, they actually had a disposable needle in 1954. So for other immunizations, DTP, tetanus shots and different things, they were using the long needles, but just the Salk virus and Salk poliovirus vaccine came in the disposable version. And then, since the public turned away from Salk, associating it more with deaths caused, they embraced Sabin's vaccine, and the children were getting vaccinated by swallowing the sugar cubes. Nowadays, it is inactive poliovirus that is given, and the children by the age of 15 months old are given a series. So there's 3 doses given before they're age 15 months old. And now, through their brave efforts and all of their hard work, the polio virus is basically eradicated from America. In this photo, we have Dr. Elmo Eddington, who took over the Lehi Hospital and became Lehi's doctor for the city. And this is his daughter-in-law, June. So Nurse June also worked with him there. And of course, Nurse Mabel Jones. And then they added Dr. Boyd Joseph Larson. These doctors and nurses of the mid-20th century continually worked, sometimes around the clock, to provide quality health care. Many people, especially the children, owe their ability to walk to the doctors and nurses. The history of the polio vaccine is tied to Utah County, both in the shot and the sugar cube form, with positive results. The residents of all of Utah County were the beneficiaries of her dedicated and energetic nursing and teaching. So public health nursing was immunizations, but it was also Red Cross classes and parenting classes and birthing classes and such. So Nurse Mabel Jones and the healthcare professionals who teamed with her were truly healthcare heroes. So if you would like to get an emailed copy of my paper, my email address. Thank you for listening to my presentation.
So that was Michelle Tucker's presentation. Again, she's at the American Research Bureau. So now we're going to have Cherie Willis talk about book burning at the Salt Lake Public Library with maybe a twist on it. All right. Thank you, Cherie. Take it away.
Thank you. I work for the Salt Lake City Public Library, and I'm going to be speaking and reading today, so I don't talk too much, on epidemics, disease, and public health. And my paper title is A Furnace Full of Library Books. Public libraries confront epidemics then and now. In democratic societies, book burnings conjure up images of one of the most heinous of human activities. Imagine then the reaction to articles appearing in the local Salt Lake City newspapers with headlines such as "Library books burned" and "Library books destroyed." Surprisingly, these book burnings were not met with protests, but with relief, as the instigation was not censorship, but public health. These articles document how the Great Book Scare of 1880 to 1920 reached and affected the reading public in Salt Lake City. It was a 40-year period when librarians and scientists in both Europe and America debated the possibility of contracting a deadly disease from handling a library book. This was a time when fear, confusion, conflicting science, hyperbolic media all fanned the flames of mild hysteria, even here in Utah. What is striking is the numerous similarities between the Great Book Scare at the turn of the 20th century and our current examples with COVID-19 at the Salt Lake City Public Library. Over 140 years ago, contracting a disease such as scarlet fever, smallpox, diphtheria, measles, tuberculosis, and even whooping cough was almost always serious and too often fatal. Public officials tried to curb the spread of disease by legislation. In 1882, Utah territorial law demanded that individuals who had contracted deadly contagious diseases must be quarantined, and any household with an occupant having scarlet fever, smallpox, or diphtheria had to fly a yellow flag. Local refinements to the law included printing the name of the specific disease in black on the flag, which had to be displayed for the duration of the quarantine and several days thereafter. Fines were substantial for noncompliance. One local lady discovered this fact when she was arrested and fined. She had covered up the flag as she felt it detracted from the aesthetic beauty of her home. In the 1880s and 1860s and 1870s, scientific discoveries helped people understand how disease might spread. The new germ theory gained wide acceptance over the prevailing theories for the spread of disease, such as transmission by miasma. These scientific advances coincided with both the public library movement and the public health movement. In 1879, William Frederick Poole of the Chicago Public Library became intrigued with the question of whether or not holding a library book could transmit a deadly disease. He began to investigate the possibilities by contacting physicians and librarians around the country. This small paragraph appeared in the Salt Lake Tribune, July 9th, 1879, thus alerting the citizens of Salt Lake City about the potential dangers of reading library books. Over the next 4 decades, scientists and librarians would grapple with this question, often at odds with each other. Anecdotal accounts began to circulate, linking library books with disease and death. Elaborate scientific experiments were performed, and dozens of guinea pigs died for the cause. One scientist's experiment led him to believe that even venereal diseases could be contracted through handling library books. Debates in medical and library journals took on contentious and sometimes sarcastic tones. In an article, December 1883 issue of Library Journal, the author lamented the dangers of modern living with pollutants found everywhere. He sardonically opined that with the newly discovered risk of catching a disease from a library book, the public should only read books that had been certified as having never been in the hands of an infectious person, or better still, to never read a book that had been read by any other person ever. Some scientists and librarians insisted that catching a disease from a book recently in the possession of an ill person was highly unlikely. Nevertheless, to be safe, both camps agreed that such a book should be at least fumigated, if not destroyed. In the autumn of 1899, the Salt Lake City Free Public Library was less than 2 years old when the possibility of contracting a disease from a library book began to seriously worry the public. On October 22nd, 1899, the Salt Lake Herald-Republican ran this story under the headline, "Disease is Spreading Fast." The article stated, quote, "For the purpose of minimizing the danger of spreading disease by the free use of books, the staff of the public library keeps in daily touch with the health department records. Whenever any reported case of contagion checks with the library's membership list, the book borrower is promptly notified by mail to return his or her books to the health department for fumigation instead of to the library. Now, this was not a great inconvenience, as both the city library and the health department were housed in the city county building in 1899. Now, in the city library, we have this wonderful record in the letterpress book of librarian Joanna Sprague. And she recalled years later that every morning, the library staff called the health department for the list containing the names of quarantined citizens, and then carefully compared the names to the roster of library cardholders. If any borrower belonged to a household under quarantine, then the library sent a letter advising the patron what to do. This is the first time that this is tipped into the letterpress book, and you can see that this is for scarlet fever victims. Also, along with the list of sick patrons, there is a copy of the letter sent out by the library to homes where there was a quarantine. And the letter reads this: "We are notified by the health department that you are in quarantine for," and then the library would fill in the blank with the disease. "When the quarantine upon your house has been raised, will you kindly return all books and membership cards that may be in your family to the office of the health department, number 2, basement, city and county building. If you have no books, destroy all membership cards and new ones will be issued to replace them." I think it's interesting to note that even library cards owned by families who had caught these fearsome diseases were to be destroyed. Initially in Salt Lake City, fumigation using formaldehyde was the prescribed method for handling books that could carry contagions. However, by December 6, 1899, the headline in the Deseret Evening News announced, "Library books burned." The article stated, quote, "The trustees of the public library have decided that the mere fumigation of books used in families where scarlet fever has broken out was an insufficient safeguard against the further spread of the contagion, so they have ordered the books to be burned. The books thus condemned were few, but the trustees felt in duty bound to take such steps," close quote. The librarian and the library board wondered if borrowers should compensate the library for new or valuable books that had been destroyed. It was also suggested that where valuable books belonged to the library were found in infected homes of people who were, quote, "palpably able to pay for them," close quote, that the said books could remain with the patron who would compensate the library for the tainted volumes. The city attorney was consulted, and fortunately, these punitive measures were not foisted upon families already suffering the effects of dangerous contagions. Those families who had paid for books destroyed by the health department did receive refunds. Now, the debate over fumigating versus incinerating suspected books continued over the next few decades. In January of 1900, the city library suspended circulating books for an entire month, but kept the reading and reference rooms open when there was an uptick in smallpox cases. Using a storage room in the basement of the city and county building, all the books in the city library were fumigated at a rate of about 3,000 at a time. However, by April of 1901, when smallpox had again broken out in the city, the library decided books coming from the hands of smallpox victims would not be saved. Mrs. Sprague noted that in some years, books returning from homes with lesser diseases, such as measles, mumps, were fumigated, while books contained by the more dire diseases, indicated a final disposition in the furnace. On October 16th, 1902, the Salt Lake Herald reported that rumors were circulating how officials of the public library were carelessly allowing books from quarantined homes to be returned to the library and then given out to cardholders in an article entitled "Libel at the Library." This article then repeated the arduous tasks performed to ensure that no books returned by infectious persons were reshelved at the library without proper steps being taken. These procedures were in place not just for a few years, but for a few decades. The most significant list in the copybook of borrowers living in quarantined homes covers May 1900 to September 1902. The list includes names, addresses, and the diseases contracted. Obviously, this is way before HIPAA. Again, in 1905, a relatively healthy year, the library board sent a letter to the health department inquiring about the effectiveness of fumigation over destruction of the books. But then an article in the Salt Lake Herald Republican in January of 1908, reassured the public that all books found in quarantined homes would be turned over to the health department for burning. The article stated, quote, "Physicians say that germs lurk in the pages of a book more than anything else," close quote, thus adding the weight of science to the fear that a book could make you sick. By October 1912, the Journal of the American Medical Association published an article questioning whether books recently in the hands of a scarlet fever victim could indeed transmit the disease. But the author, Dr. Otis Nesbitt, decided to err on the side of caution and concluded that books handled by a scarlet fever patient should be either fumigated or destroyed by burning. Like many scientists, Dr. Nesbitt felt that even though the chance of contagion was profoundly remote, it was always better to be safe than sorry. The most significant number of books destroyed occurred in April 1918, when 69 books were sent to the city and county building furnace. Understandably, during the apex of the influenza epidemic in Salt Lake City, the number of books destroyed was not as large due to the fact that for 2 months, from October to December 1918, both the reading or all the libraries were closed. Circulation resumed on December 9th, but the reading room was not reopened until 2 days before Christmas. The city library's January monthly report reported that from that short time period of just 3 weeks, there were 51 books that were destroyed in the furnace. Considering the furor over possible contamination coming from library books, I think it is remarkable that in the spring of 1920, the Salt Lake City Free Public Library established satellite libraries in St. Mark's Hospital, Holy Cross Hospital, LDS Hospital, and the County Hospital. Once a week, a city librarian would walk the halls of the hospital with a truck laden with books and magazines, and no one seemed concerned about acquiring a communicable disease in those hospitals. The Great Book Scare had run its course by the end of the influenza pandemic of 1918-1919. However, books were still sent to the health department through 1929 for destruction. By then, it appeared this episode in library history was finally over. Then SARS-CoV-19 arrived in the United States in 2020, and the same question debated all those years ago returned. Can a reader catch a dread disease from handling a book recently in the hands of an infected person? The initial answer seemed just as elusive in 2020 as it had in 1900. The city library closed on March 15, 2020. Postponed due dates on materials, and hoped the curve would flatten in a matter of weeks. As COVID-19 case numbers continue to rise, the city library, like many libraries across the country, determined that library services must be made available in new ways. While the public was not allowed in the physical library, staff returned to their buildings to collect materials turned in from the outside book drop bins. All materials were quarantined in those bins for 3 days without touching before they were checked in, reshelved, or sent on to other patrons. Reference questions were handled by librarians who worked at home. Library programs that could be adapted were turned into virtual events. Like the 3D printers at the Marriott Library, our 3D printers were put to work creating face shields. Library staff were actually given time to participate in Project Protect, which was a local initiative to sew 5 million medical-grade face masks in 1 month. Staff also assisted in constructing 400 face masks strictly for library staff use. When limited numbers of patrons were again allowed back in the building last fall, surfaces were rigorously sanitized and social distancing via floor stickers was enforced. One interesting and non-lethal correlation between the influenza pandemic of 1918 and COVID-19 pandemic is the increased popularity in cookbooks. Ms. Sprague, the librarian in 1918, reported that other than books on war and fiction, books on food and cookery were in the highest demand. In 2020, the sale of cookbooks rose 19% over the previous year, and the New York Times bestsellers list includes these books you see here and numerous other cookbooks. Books guided the home chef particularly favored comfort foods, which is not surprising in a pandemic when the nation isolated for months, and home cooking gave the home cook that sense of personal control. The city library has seen a significant increase in cookbook requests over the past year and has launched a virtual monthly cookbook book club, which literally garners at least 60 registrants. In 2020, even with modern science, the ghosts of the Great Book Scare have returned. In January, February of 2021, the American Libraries issue posted this in magazine poster that is from the Reopening Archives, Libraries, and Museums, or REALM project. This project tested survival times of SARS-CoV-2 on a variety of library materials. As the virus was detected on surfaces up to 8 days and beyond, the question posed 140 years ago still perplexes librarians in the current pandemic. Can a person catch a disease from a library book? Just like our counterparts 140 years ago, with conflicting scientific opinions, intense media coverage, and truly high stakes, the city library has tried to balance providing our patrons with the best possible service in the safest possible manner. The 3-day quarantine on books dropped to only 1 day, and currently we no longer quarantine books that are returned. Today, the general consensus simply is this: library books cannot make you sick. Public libraries have evolved into so much more things than just a repository and a lending service. COVID-19 has challenged libraries to continue that evolution. At the city library, we have had to reimagine many of our services to improve our capacity to remain relevant and support our communities. As we emerge from this pandemic, hopefully we will be more nimble, compassionate, and better equipped to handle whatever the future may bring. Thank you very much for letting me share this little piece of library history with you.
Thank you, Cherie. Next, we will finish up with Ron Watt, who will be talking about the coal camps and coal camp doctors of Carbon County. So with that, I'm going to invite Ron to speak.
Okay. On an early, cold, wintry December morning, the 28-year-old George Watt started from Greektown in the Spring Canyon coal camp to run down Salbella Gulch. The breeze chilled his cheeks, but he hardly felt it. He stumbled on the railroad ties as he crossed the track. He was headed to Dr. Lavelle Merrell's house, about a half a mile away. His pregnant wife had awoken him, telling him that her baby was coming, and he needed to get the doctor. Their older child, LaRue, was sleeping in the other room of this rock four-room miner's cottage. He hoped that she would not awaken because Norma could not take care of her. After several twists in the road, he arrived at Dr. Merrell's. He knocked loudly on the door, knowing that he was asleep. His wife, who was the camp nurse, answered. Within a short time, which seemed like an eternity to George, the doctor appeared dressed with his bag, ready to greet a new baby. They got in his car, probably a Model A Ford, and made their way up the canyon. When they arrived, Dr. Merrell examined Norma and they waited. No baby. False alarm. The doctor left, and both Norma and George felt embarrassed that they dragged the doctor out of his bed. 1 week later, on the same day of the week, but this time in January of a new year, and about the same time, 4 a.m., George again found himself running down Salbella Gulch from his home in Spring Canyon. He even stumbled on the same railroad ties as before. He was just as determined this time to find a good doctor. Norma had waited until the last minute and finally reached over and tapped him, saying, George, I think it is time. The wind this time was a little more fierce, and he felt it blowing at his face and body. The doctor, who loved people, was patient with him, loaded him in his car, and again they made their way up the canyon to that home which was near the mine's portal. Norma was so concerned about getting the doctor out of bed last time with a false alarm that they almost arrived too late. Within a short time, at 5:45 a.m., a son was born. To George and Norma, it was a wonderful occurrence. To Dr. Merrell, it was just another happening at the beginning of another day in the life of a coal camp doctor. In 1937, Dr. J. Eldon Dorman arrived in Gordon Creek to be the company doctor of Consumer Sweets and National, 3 coal camps situated rather close together up this canyon. Shortly after his arrival, he came face to face with an experience that could only happen in a mining community. In this case, at the end of the day and not the beginning. On a Saturday night, he received a call from the beer parlor and suites. He found an older gentleman sitting on a chair against a wall with his head hanging down against a bloody chest. Upon examination, he found a superficial cut across his neck from ear to ear. He discovered the cut had not penetrated the major blood vessels of the neck. He did not want to take him back to his office to sew him up, so he put him on the pool table. And with the jukebox screaming and sometimes comments from the audience, he began to put stitches in his throat. Then someone said, "You should go find the perpetrator, Sam." He found Sam, a big burly Austrian, in the bunkhouse, holding a bloody washcloth to his bleeding, lacerated scalp. To help drag Sam away from the men in the bar broke 13 bottles of beer on his head. Dorman looked at him and asked him how he was. Sam replied, "I feel pretty good, but I do got a little bit headache." Dorman spent the next few hours digging glass out of his bald head. Just another experience in the life of a coal camp doctor. The coal camp doctor had a special place in the community. He was hired by the company and thus was a company man. His main job was to treat the men who were in accidents in the mine. Mining coal was dangerous work. Men dug tunnels into the depths of the earth after this black rock, knowing that any time these tunnels might come tumbling down. They supported the ceiling with timbers, but how long could a piece of wood prevent and stop thousands of pounds of pressure, especially if the earth shifted? To get that coal out of the earth, the miners used explosives. They had trained men to do that type of work. But again, something could always happen that could go awry. George Watt, whose job was classified as a shot fire, said that after hooking up the site that had been mined, he retreated to a safe place to blast the roof of that room down. He watched as timbers snapped and the roof collapsed. I always wondered what was a safe place. The company expected that if a serious accident occurred, the doctor needed to be at the portal of the mine almost immediately. How often that happened, we cannot determine. Troy Madsen, in an article entitled The Company Doctor, Promoting Stability in Eastern Utah Towns, describes certain different types of mining injuries, from the mining heavy equipment, which injured MC Brennan when he suffered a contusion of the chest, to an explosion of gases in the mine when Joe Rossi burned head, face, neck, and arms, to when Melvin Higginson received an acid burn on his hand. In some cases, many men were injured or even killed. These are just a few of the different examples. For many accidents, the company required the company doctor to be ready and usually to be at the mine entrance. In Kenilworth, the whistle signaling the end of the work shift sounded automatically at 5 p.m. When the town's populace heard that sound at another time, it meant a serious accident had occurred in the mine. Eva Trumpvine Dixon mentioned when she heard it, it was, quote, "it was really scary. It usually meant there had been an accident in the mine. What a tragedy when one of the men was badly injured or killed," end quote. In an essay she wrote, she describes an ambulance passing the Kenilworth school bus on a March day in 1945. Quote, "What a sinking feeling, not knowing who would be in it or what had happened," end quote. Another 12 men were injured that day in that explosion. 7 of them died from those injuries. Oftentimes, when the whistle sounded, the wives dropped everything and rushed to the mine portal. Dr. Dorman mentioned that the company requested him to meet the more seriously injured at the portal. From his office, it was quite a walk, so he began taking his car. However, the mine entrance was in view of the entire town, and every woman in camp recognized his car. Quote, "Soon each was standing on her front or back porch, wringing her hands or her hands on her apron and wondering if her husband or son was hurt or killed," end quote. He decided not to drive up again. Quote, "The ever-present fear of death in mine accidents, explosions, or after death already haunted the families enough," end quote. Dorman told another story of perhaps near death for him. One day he went underground with the mine superintendent, Terry McGowan, who showed him a new joy loader. McGowan then left him for about 20 minutes. Dorman found a place off to one side where he could watch, not be in the way of the crew. Then the two of them left, and Dorman returned to his office. About 2 hours later, he was called to the mine to take care of the injured joy loader's helper, who had been standing in the same spot as Dorman had a few hours before when a roof fall buried him and broke his back. The coal company withdrew from the miner's paycheck at first $1 a month, placing the money into what was classified as the welfare fund to pay for the good doctor's services. When he was hired, Dr. Dorman's check from the company was $300 a month. Standard Coal Company paid Dr. Merrell $10,000 for the entire year of 1946. For that money, the doctor provided medical care for the entire family. The welfare fund paid not only for the doctor, but also for the nurse. It paid for office calls and all house calls. It covered all medicines dispensed by the doctor. A favorite medication was a wild cherry flavored cough medicine. Every doctor prescribed it. Dorman certainly did. That is until Dr. Ira Cummings told him a good portion of that syrup goes for people's pancakes. Thereafter, Dorman used a syrup of white pine tar. The welfare fund did not cover some surgical items. Baby deliveries, tonsillectomies, appendectomies, fractures, and other procedures were extra. The company provided the doctor's living accommodation, oftentimes an apartment or a house, an office, and a 4 to 16 bed hospital, for which the doctor paid a small sum. Serious accidents were not treated in the cold camp hospitals, but were sent to the hospital in Price, the largest hospital in the area. The camp doctor knew everybody in the small town. Injuries and especially deaths were hard on him. It was personal to him. He made house calls to probably every home in the camp. He knew these people and had grown close to them. Catherine Merrell, the wife and nurse for Dr. Merrell, said, "Your family saw every death. Every birth was just like it belonged to you." She told how Dr. Merrell hesitated to give the little children shots because he did not want them to fear the doctor. When he had to do this, he would put on a false nose and eyeglasses. Then, quote, he would tell them he wasn't the doctor. He was just the person who gave the shot or whatever. I remember that so well. The kids loved him, end quote. These patients became extremely close to their doctor. When he was making house calls, they would often say, "Oh, sit down and eat with us," or "I have just cleaned some vegetables. Would you like some?" Or "Would you have a piece of cake or a piece of pie?" Merrell had a boat built, which he used on Schofield Lake. He called it "Hey Doc." Whenever he went, someone would say, "Hey Doc, can I talk to you a minute?" Or "Hey Doc, something else." It was an endearing term. She described him as very gregarious and a person who loved all people. He disliked making house calls because most of the problems could wait until they came into his office, but he did it. It was a necessary part of his job. Carol Garden, a little girl at the time, recalled Merrell as being an inspiring man. He came to their house in Hiawatha, be it raining, freezing, snowing, or dead of night. Sitting on the side of the bed, he inquired of her aches and pains, quote, while emitting soft clucks of sympathy. Between clucks, he murmured, "Aha, never letting on that he already knew the problem," end quote. Eva Trumpvine Dixon remembered Dr. Roy Robinson in Kenilworth making house calls, all dressed up in a dark suit and his little bulldog walking along with him. Most of the children remembered the shots. In the spring, everybody waited in long lines for tick, diphtheria, or typhoid shots. Geraldine Dudley said that the needles were large and left a hole in her arm, and for 3 days afterwards, quote, "we could not move our arms because they hurt so bad." Glenn Thomas mentioned that Dr. Lemon came to their home because of a measles outbreak. Using a frying pan full of water, he would bring it to a boil and then place 3 needles in it. Then he would boil it some more. He used those 3 needles on every member of the family, boiling them after using them. Thomas thought that he must have used the same needles on the previous family. The doctor had other methods of doctoring. During the great flu pandemic of 1918, they put a quarantine sign on the door, which told others not to come into that house. Those inside had to wear masks when they went out. Doctors also quarantined their patients for measles, mumps, and other communicable diseases. Dr. Andrew Dodd, a physician in Sunnyside, was probably the most famous of the early doctors in the county. He had one of the few cars in town and was always on call, visiting patients with his familiar black bag. Dodd was a rather rough man and would walk into homes without knocking. He constantly told immigrants to keep chickens and pigs out of their houses. One Austrian woman was butchering hogs 5 days after childbirth, and Dodd made her go back to bed. When her second child was born, the woman hired a girl to do her housework and went to bed in order to have her baby, the American way. Dr. Dodd dispensed large quantities of castor oil as medicine for various ills. Children found ways of disposing of it, but he usually discovered the secret and cautioned mothers to make sure their children took the medicine. Everybody idolized the doctor. Even children were usually anxious to see him, whether for vaccinations or more serious problems. One former Sunnyside resident recalled, quote, "They loved and trusted the blustering old crank," end quote. Dodd had two other brothers in the county for a while, Richard Dodd in Kenilworth and James Dodd in Hiawatha. Dr. Roy Robinson was another doctor who was much remembered and much loved by the people of Kenilworth. Eileen Burton Mankins, a former resident, commented that Robinson was always so good to everyone. When she was 9 years old, she got pneumonia. After weeks of treating it at home, he told her she had to go to the hospital. Quote, "I almost died, but Dr. Robinson was there, and I finally responded to the medication and care he gave," end quote. Another former resident said that Dr. Robinson was a very important man in town. She went on to say that he took care of all, quote, "our cuts, bruises, childhood diseases, inoculations, and operations that were needed, delivering all the babies, and took care of all the mining accidents," end quote. Let's now look at a couple of nurses. When Catherine Darton Merrell was 2 years old, her family moved to Helper, Utah, and she was educated in the Carbon County schools, going to school in Helper and graduating from Carbon High School in Price. When she was 17, she entered the W.H. Groves LDS Hospital School of Nursing in Salt Lake City and graduated in 1935. She worked at Standardville in Hiawatha. After starting work, she married Dr. Merrell. She remembered many cases. In the Hiawatha mine, there was an explosion that killed 2 men. In that case, Dr. Merrell had to go into the mine, which she hated him to do. She was afraid that if there was a cave-in, he would not know where to jump to get out of the way of a cascade of rocks. In this case, she had to stay at the hospital. Someone had to be there at all times. She also remembered many men being brought in on stretchers. Each individual, quote, "would be black from the coal dust. I would have to wash them before I knew what or who I was dealing with," end quote. Mary Blaffo was born in Rolap, a camp town near Castle Gate. When she was in her late teens, her mother moved to Mapleton after her father was killed in a coal mine. She went to an LDS hospital near a nursing school and then went to Springville to work. But within a short time moved to Standardville, where she obtained more money, almost $30 a month more. She involved herself with everything to assist the doctor, from providing care for injured miners, treating infectious diseases in the camp, caring for children, and assisting with delivering the town's babies. When the Standardville mine closed in 1955, the hospital closed, and she moved to Price, again in a clinic assisting doctors in their work. The ease of transportation and closing of the mines ended the career of the coal camp doctor. With better roads, the miners and their families can now live in a larger population center where he could commute to work. They found doctors near their homes, but they were not company doctors. Also, with better roads, fast ambulances could transport an injured man to the hospital in Price, where he could receive better care than in the small camp hospital. Mechanization came to the mines. It meant fewer men in the mines and therefore fewer accidents. Most of the mines closed and the population in these coal communities dispersed. Without the coal camps, doctors no longer made house calls. The doctors also moved into larger towns and cities. Dr. Dorman went back to school and specializing in eye, ear, nose, and throat. He returned to Price and established a good practice there. Dr. Robinson also moved to Price. The echoes of the camp of the past are now gone. No longer can we hear the hurried footsteps of a man rushing down Salbelly Gulch to find the doctor. Only deer graze there now. Neither can we hear the revelry of men in the saloon as the doctor sews up a miner's slashed throat on a pool table. The Kenilworth whistle notifying everyone that an accident has happened in the mine does not ring. So women do not stand on their back porches wringing their hands, playing with their aprons, or rushing to the tramway to discover who was hurt. The camp hospital is gone, as are the doctor's office and cottage. Very little is left of these coal camps of the past, only memories. Only with great imagination can you still see the outline of the Spring Canyon tipple spanning the canyon, or the doctor's office and the hospital in Hiawatha, Kenilworth, Standardville, or elsewhere. in most cases, it's difficult to think that men, women, children, and even the cold camp doctor lived, breathed, suffered, and even enjoyed life in these now silent places. Thank you.
Ron, Cherie, and Michelle, not here. Thank you very much. I want to ask if you all have any questions for each other. We're really short on time, but I want to say ask if you have any comments for each other.
I think Cherie's paper was very fascinating. That's the only comment I have for it, because I didn't realize there was book burnings in Utah, especially, and for this reason. That was really good.
Oh, thank you. Yours was amazing. Where did you get all of your research?
From different books I've collected and things like that. Different sources.
It was delightful. Thank you. This has been such a great experience for me to be able to participate. So thank you, Dr. Watts. Thank you, Holly.
You're
Thank you,
welcome.
Holly.
Oh, we have one question for Ron. Any information on Latuda? Am I saying that correctly?
I don't have a lot of information on Latuda. It's not as far as doctors are concerned. Latuda was a town about 600, maybe a little over 600 people in 1920. That's about the greatest number. It did have, the school went up to about the ninth grade in Latuda before they had to then transport all of the kids to Price thereafter. That's about all I have as far as Latuda is concerned. It didn't stay open as long as some of the other mines did.
Thank you. You know, Jedediah Rogers made a comment to you, Ron. He said you paint a poignant portrait of coal camps and medical care. Then Jed says, thanks to you all. I think that I was really impressed with the value of local history and preserving local history throughout this session. You know, you can't get this always in a big survey. You know, the individual stories and the just the on the ground, the story about the little lad in the sheep herder's wagon really struck me. The little guy wearing siding to try to be cared for, and these stories about you know, being a delivery in the morning, hoping that the doctor is able to be there. Those are very poignant, and I want to thank you all for preserving local history and doing that work. And well, thank you. It's a really excellent session, all of you. And thank everyone for attending, and we hope to see you tomorrow for our keynote address. So with that, thank you, and we will sign off for the day.
Thank you.
Thanks, Holly.
Yeah.
Thanks, Ron.
Yeah.
Bye, Sadie.
And bye. Thank you, Sadie.
Have a great day.
Let's end the record.